Thank you. So I have no disclosures. Well, my name is Tove Wadensten. I'm a PhD student at Umeå University here in Sweden. I'm also a member of the Incontinence research group. Today I want to present the results from a randomized controlled trial of a new smartphone app which we developed within our research project. So the main question for this study was whether a smartphone app can be an effective treatment for urgency and mixed urinary incontinence in women. The background to this is that, as many of you in this room already know, urgency and mixed urinary incontinence are common conditions and together add up to almost half of all the cases of urinary incontinence in women. They also have a potentially large impact on quality of life. However, there has been described a reluctance to seek care, and it has been proposed that it may in part be due to those conditions being stigmatized. Apart from drug therapy, the recommended first-line treatments of those conditions are pelvic floor muscle training, lifestyle advice, and bladder training. So we wanted to develop a new app, since we have already shown that a smartphone treatment for stress urinary incontinence in women was effective, and it was also perceived as lowering the barrier for help seeking. So we developed a new app, and this was a randomized controlled trial to evaluate this new app. It had 2 arms, and it was registered on clinical trials. The primary outcome in this study was the difference between the group in the ICIQ-UI SF score at 15 weeks. We performed a linear mixed model analysis according to intention to treat principles, and the principal investigator of this study was Professor Eva Samuelsson. We had several inclusion and exclusion criteria. In the inclusion, we wanted to make sure that the women had a leakage of at least 2 times a week and the symptom duration of at least 12 months. The exclusion criteria centered on certain medical conditions, as well as pregnancy and some alarm symptoms that we felt were better investigated in usual care. Here's the flow chart for the study. 1,241 women were assessed by a web-based questionnaire. The majority of those women were deemed ineligible, and this was mainly for not meeting inclusion criteria. 142 women enrolled in the study, and a further 19 were deemed ineligible at a telephone interview prior to randomization. 123 remaining women were randomized to receive either the intervention, which we call the treatment app, or the active control, which we call the information app. At 15 weeks, they were followed up, and at this point, 2 women in the treatment app group were lost, but none in the information app group. Here are some screenshots from the intervention. This is the treatment app. It centers around 4 themes: pelvic floor exercises, bladder training, psychological education, and lifestyle advice. The pelvic floor exercises and bladder training was several steps programs with increasing difficulty. The app also contained individual advice, as well as the ability to set reminders to keep up with the training. The information app was a very limited version of this app. It contained only brief information and no exercises and no other functions. The baseline data showed that there were no differences between the groups with regard to age, BMI, or university education. You can also note that this was a group of mainly highly educated women. Most of the women had mixed urinary incontinence, and they also had a high amount of incontinence episodes per week. And again, there were no differences between the groups. Looking at the ICIQ SF scores at baseline and follow-up, we could see a significant decrease in both groups, but the decrease was significantly larger in the treatment app group. And looking at our primary outcome, which was a comparison of the ICIQ-UI SF scores between the groups at the 15 weeks follow-up, we could show that the estimated difference using a linear mixed model was minus 3.1, and this was a highly significant result. So in conclusion, can a smartphone app be an effective treatment for urgency mixed urinary incontinence in women? Our results clearly show that yes, it can be, at least for women who are interested in self-management and e-health. Thank you.
The floor is now open for questions.
Hi, Jeroen Vorm, Leiden, in the Netherlands. A question: could you also look at how many times they actually used the app or opened the app or stayed on different pages?
Thank you for the question. We had an initial thought that we should do this, but it was technically difficult. So we could only register that they had opened the app, and we could get a vague amount of, like, had they opened those exercises, but we could not see clearly. We cannot calculate on those results, unfortunately.
Thank you.
Other question? I have a question for you. You mentioned in the abstract that you were using an algorithm to try to exclude some other condition, and I was wondering if you can tell us more about it and if it's validated, because it seems to be interesting that we can screen participants through that kind of algorithm.
Yeah, and we had an abstract on this last year, ICS. As you can see on this slide, this is the algorithm. I imagine it's hard to read because it's very small text, but as you can see, there are many steps, and it centers on alarm symptoms. Like, this was included in a web-based questionnaire. So the participants first got questions on, like, painful allergies. Then if they had painful allergies, they were redirected to usual care. But if they did not, they could proceed in the questionnaire. So we went through the steps, those questions we thought were relevant for redirection into usual care. But it was not validated. This was something we came up with from discussions in the research group and discussions with professionals from different fields.
Yeah. Cláudia Hackard from Brazil. Very nice presentation.
Thank you.
I'd rather ask about if it's reliable for the majority of people that not so well educated. Is it reliable or not?
Could you specify what you mean reliable?
If you have good results with women with no education.
Yeah, as you could see in the slides, the majority of women in this study was well educated, and that is a problem, and it's common for many of those studies, especially e-health studies. What I'm trying to do in my PhD thesis is to look with interview at those women who are maybe not represented in those studies, to see how they perceive an app like this. Is it too much text? Does it need to focus on other areas, and so on? Or is it just like if you are not well educated, perhaps you rather prefer to meet a face-to-face contact? So I'm trying to look at this in further studies.
We work in public hospital in Brazil, and we think about it, and is it a limit or not?
Yeah, exactly. I think it's a great concern.
Thank you.
Thank you.
I have a question for you. We know that peripheral muscle training is effective for stress urinary incontinence and predominant mixed incontinence with predominantly stress incontinence, but you had urgency incontinence and mixed incontinence. So did you do any specific peripheral muscle training for that, or was it the regular strength training principles that we all use?
The basis of the training was regular pelvic floor muscle training with 4 different types of contractions: strength contractions, endurance contractions, and basic contractions, and fast contractions. So this was the same for all of the women, but we had individual advice based on their condition. So if they had the urgency, predominant urinary incontinence, they would often be directed to also use perhaps bladder training, which was a combination of pelvic floor muscle training and trying to postpone voiding. Mm-hmm. So it was based on results from a micturition chart done at baseline and also on questionnaire responses.
We know that when you're contracting the pelvic floor, there is an inhibition of the detrusor contraction. So you didn't add anything specific on that. So when you have the urge to void, that they could contract the pelvic floor and then try to stop this urgency and have time to get to the toilet. Did you do anything?
Yeah, that was the basis for the bladder training. So they were encouraged to, when feeling an urge, they would contract, and we had a visual guidance for this along with a timer to postpone the voiding.
But you don't know what they have been doing?
No, unfortunately, we cannot see that.
No.
So.
Any more questions? Thank you very much.
Thank you.